When she was a field general as the chair, we loved her. And I'll tell you right now, in the trenches, where she is with us, there is no better fighter, there's no better advocate, there's no better voice. So Rosa, thank you so much. And the numbers are sort of daunting. Sort of the volume of numbers don't really make a lot of sense. But Rosa was talking about really the lives of people that we encounter. I just want to tell you about a few of them. Amy Gagliardi pulled me aside the other day, and Amy, you might know, she runs our prenatal program. It's been with us for over 20 years. She was telling me about how the team responded for a young mom who came in, and the receptionist heard that she really wanted to start a family. And it turned out she hadn't been in for care at all. She was coming in for another thing, and it looked and said, you haven't had a pap test in years. And the receptionist let the medical assistant know, and they made sure that day they had a pap test. Well, it turned out they did a pregnancy test, and to her great surprise and happiness, because she came because she wanted to start a family, she was pregnant. And Amy was right there with prenatal vitamins. And you just think about the sort of the simple lives, the connections, having those prenatal vitamins, getting into prenatal care, and she was uninsured and not insurable. So she had sort of walked away from care before. I got a letter from a patient, Rosa, who said, I'm writing about a year after I came to the health center. I was uninsured and I had diabetes that was out of control. And when I came in, I had sort of a blood level that's twice the acceptable level. It was A1C, it was 14 instead of 7. And it was totally uncontrollable, and I had no job. And I'm writing to tell you that your team pulled together. They had that retinal screen that I can't believe that you shoot the images up to California, you have your Yale ophthalmologist read them, and you send them back to an electronic record because that's a standard of care. But I'm now at 6.5. I got those dentures that I needed, and I got a job. Now, I say the connections between dentures and jobs. People don't understand. People don't get jobs when they come in without teeth. They just don't get jobs. And so the last one was a doc who had written an article that appeared in one of the Connecticut papers, and he said, patient was in front of me. He had a huge infection on his elbow. And he's telling the story that he went to the surgeon, and the surgeon said, I need cash to take the pus out of the elbow. And I didn't have the cash. And he came and he saw the doc who took it out and probably saved his arm. It turned out he hadn't been taking his insulin. His numbers were like 300 because he couldn't afford it. Now, why couldn't he afford it? He had insurance. But he had one of those insurances that just doesn't pay anything. It gives you the card, but it doesn't provide you any care. And so he had an incredible deductible that he could never meet. And we're able to buy, because of the work that Rosa does, medications at 50% of the cost, and pass those on, and now back on his insulin. And I think these are the stories that I think we all care about. And we have them in education, early childhood, regular education, special needs. We have them in healthcare, and I think we have to connect the dots for people about the real lives. The numbers are numbing. 1 billion here, 1 billion there. But the stories are really powerful, and they tell a message. And really, the work that we do, our ability to grow, starting next year, 40 years here in Middletown, but now in 170 locations throughout the state of Connecticut, caring for 130,000 people who come to us during the course of a year. And it's really because of the work that Congress had done. And let me tell you something. The Community Health Center is not a Democratic initiative, nor is it a Republican initiative. It's an American initiative. Orrin Hatch and Ted Kennedy came together, like Rosa has done with her colleagues on agriculture, came together 30 years ago and said, this is a good program. This wasn't about politics. And I'm not here to bash anybody from any party, but it's about understanding your community and about relationships. And we have a group of people who are disconnected. They came to tear down the government. But when you tear down the government, you're tearing down the lives of individual people. And we need people with a voice and value who understand and can communicate, and we need to do it. We need to continue this work to communicate. And Rosa, thank you so much for your leadership.